Hello, everybody. This is Gary. Today is December 31st, 2022. It's 2:09 p.m. Eastern Standard Time in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Happy New Year's to everybody. 2023 is right around the corner. Today, my psychiatric symptoms are not that bad. My paranoia and delusions are not that severe. My auditory hallucinations are not that severe. My anxiety levels are a little elevated. My depression is not that severe. I have an appointment with my therapist on Tuesday. She's my new therapist. I already met her once, meeting with my old therapist and her at the same time. I was given very short notice that I was getting a new therapist, which kind of made me angry, but it is what it is. I still have the same psychiatrist. I still have the same peer support specialist. A peer support specialist is somebody with a mental health diagnosis who works on staff at my clinic as a counselor. So I'm also seeing my psychiatrist on Friday of this, or actually next week. And we'll be going over my medications and stuff. I don't think we'll be planning on changing anything. The last change we made, we went from 10 milligrams of Zyprexa twice a day to 5 milligrams of Zyprexa twice a day because I had urinary retention, and everybody agrees to seem to think that it was the Zyprexa, also known as olanzapine, was causing the urinary retention. I required a urinary catheter be put in and connected to a urinary leg bag for a week and a half. I went to the urologist after we reduced my Zyprexa. They removed the catheter. They filled my urinary bladder with purified water, and I was able to void it out and able to urinate normally after that, so the catheter was able to stay out. I have had this problem before, but it required surgery to correct it. I had prostate surgery and I had urinary bladder surgery in the past 2 years. And the only other surgery I had was on my right knee because I had a torn meniscus, and an x-ray didn't show any broken bones, but my right knee was still in a lot of pain. So I insisted that my doctor do an MRI of my knee, and they detected a torn meniscus. And during surgery, most of that meniscus was removed, and my right knee is still kind of sore, certainly not as bad as before surgery. I had the surgery done on May 13th, so it's been less than a year. The surgeon did warn me that my knee could hurt up to a year after surgery, and that I have to continue to do physical therapy and walking exercises for my knee. And actually, my back specialist also said that I need to continue to do physical therapy to strengthen the muscles in my lower back, because the bottommost disc in my spine is very, very flat and worn down. It's oddly enough not causing a great deal of physical pain. That's why we decided not to do any surgery on my back, because I'm not experiencing any excruciating pain in my lower back from the disc. But the spine specialist did say that he wants me to do physical therapy for my lower back. I do my best to keep up with all my medical appointments, as well as my psychiatric and therapy appointments, and my counseling appointments. I rarely miss appointments. The only reason I would miss an appointment is because I'm physically very sick, or an emergency comes up that I have no control over and I have to change the appointments. But that rarely ever happens. My motivation to do things over the past few days has been pretty crappy. I didn't do a video yesterday, and I just finished cleaning my kitchen, which I haven't done in about 2.5 weeks. And waiting that long to clean my kitchen makes it very, very dirty. It makes it all the more difficult to clean it. I finally did clean it today. I cleaned one section of my apartment at a time instead of trying to clean it all in one day. Um, Tomorrow I'll probably clean the bathroom. Day after that I'll probably clean the living room. I have no bedroom. For me, I live in a studio, so the bedroom and the living room are the same room. I have a bed and a couch in here and a table and chairs and some fans. The weather outside is kind of rainy and cold. Rochester did not get hit severely by a snowstorm the way Buffalo, New York got completely buried in like 6, 7, 8 feet of snow in some places. Rochester has no snow on the ground. Right now, I think it's raining outside. So we didn't get hit by. We got hit by a very big windstorm that weekend, but we didn't get any snow. At least not anything to speak of. And so I guess we're lucky in that regard. Um, but eventually it will start snowing here in Rochester as well. And there will be heavy snowfall. After all, it's December. Tomorrow is January 1st. It's a new year. And snow is bound to come sooner or later. Although it hasn't come heavy in Rochester, New York yet. The weather has an effect on my mood, my anxiety, my paranoia levels, my delusions, my auditory hallucinations. They tend to get worse this time of year, and that's why I'm seeing my therapist on a more regular basis than just every 3 or 4 weeks. Once every 1 to 2 weeks. I did go to psychiatric emergency, I think it was about 3 weeks ago. They kept me for 26 hours under observation, and then they let me go. I went of my own accord. I'm the one who called the ambulance, and they always send the police when an ambulance is dispatched for a mental health call. But they didn't have to force me to go to the hospital. I think, after all, I am the one who called. But once you're there, you can't leave until you talk to a psychiatrist, regardless of the reason why you're there. The psychiatric department is a locked facility. They take away your belts, any strings that you could use to harm yourself, any sharp objects, your personal property. They take your shoes, they give you a pair of socks. You go upstairs to the emergency part of the psychiatric department, and then you have to wait until talk to a psychiatrist to be evaluated before either they let you go or they admit you to the hospital. Those are the two choices. So they did not admit me. They did hold me for 26 hours, but that's not the same thing as being admitted. Sorry about that. But that's all for now. Like, comment, share, subscribe.